Rozelle.
How are you?
This is Rozelle. She is a nurse practitioner who works at the Columbia Presbyterian Hospital. Can you tell me a little bit about yourself?
Sure. I have been a nurse practitioner since 1994. I've been working on a congenital cardiac surgery team at Columbia Presbyterian for 11 years now. I work with 3 surgeons. There's myself and one or two residents that work with us. We work in collaboration with the cardiologist and the intensivist there.
Can you speak up a little bit louder too? I'm sorry. Okay. And can you tell me what your role is in the team, within the team?
Yeah, on this team, I am responsible for seeing the patients through the whole spectrum of their hospital stay. So I begin by working with the cardiologists who refer patients in to see if that's an appropriate patient for surgery at this time. And then I will meet with the parents and the child and am responsible for the history and physical, clearing them for surgery, make sure that everything is as best as it could be. I first assist in the operating room. I follow them through the intensive care unit and help manage their care along with the intensivist, and follow through with them as they are transferred to the floor until they're discharged, and then have a follow-up visit with them as a post-operative patient.
What do surgeons do that you don't do then?
They are the primary surgeon has the expertise to make the final decision about the operation and the appropriateness of what's being done. They are the primary surgeon, and they work with us as a team. Everybody has their components that they do to make it complete for beginning to end of a child's hospitalization.
How do you ensure good communication with them? What's your method of making sure that there's actual team approach?
Finding them.
Yeah, finding them. Okay.
Yeah, every day we touch base. And any problems that are occurring and the progress is discussed with them. Any complications and their management are communicated.
And what's your relationship with them? Is it a very good relationship?
It's very good. It's a very family-oriented team. I grew up with 3 brothers, and I work with 3 male surgeons, so maybe that has something to do with it.
What about the relationship with the nurses on your floor?
The nurses are terrific. There is a very low turnover of the neonatal and the pediatric nurses, and they are a fantastic group of people with a very high level of expertise. They're fun to work with. There is a mutual respect, certainly, of working with them. Since I began as a bedside nurse, I still haven't forgotten to do all of the bedside nursing things.
All right.
They don't always allow me to do that anymore.
I see. And sorry, there's somebody behind you. Tell me your typical day, how that goes.
Typical day starts somewhere around 7 o'clock in the morning. If I'm in the operating room, I need to be there by 8:15, and I will start by rounding on the in-house patients, making sure everything is okay with them, and taking out any drains that might be ready so that they can progress through their day. And then I go to the operating room. Afterwards, I follow up with making sure everyone's chest x-rays are okay, that nobody needs any anything else done. The pre-ops are evaluated to make sure that everything, all lab work is up to date. Any consults are then done in the afternoon for patients who are upcoming or in-house being evaluated for surgery. And then I go home. The beeper stays on though,
Right.
or in case there are any particular problems after hours.
What time do you go home?
When the day is done.
When the day is done.
Anywhere from 4 o'clock in the afternoon or
Uh-huh.
8 o'clock in the evening.
Okay. And you sometimes work with residents, you train residents, the physician residents, I heard?
Yeah. There's a lot to
Part of your
learn
job.
both ways. So the training program here for the cardiac surgeons is a 2-year program, of which they spend 2 3-month periods on the pediatric service.
I see.
So we do help them. There is a lot of mutual teaching that goes on both ways. It's very collaborative.
What do you like most about your job?
It's a world of miracles and tragedies, and the miracles far outweigh the tragedies that occur. It's great to have the whole experience of following the patients completely from the preoperative point through the operation, through their discharge period, to see the whole span of everything, to communicate with the parents and to watch the children come back and see how they're growing, making sure that they're out there living life to the fullest.
They send postcards to you?
They send letters or postcards once a year. I ask them to. We have a giant bulletin board where we put their pictures up, and it's very nice to see. It's a way of informally seeing how you're doing with what you're doing, and that they're growing up and doing all different activities.
I see. And do you have any message to healthcare providers in Japan? Providers or policymakers in Japan?
Yes, to the policymakers there, I would certainly advocate for bringing nurse practitioners to Japan to add a completeness to your team, and we have been blessed with having former Japanese residents who have now returned to Japan, and they are so gifted in what they're doing that adding a nurse practitioner will allow them the time to develop their skills to become an even better surgeon in what they do, and to aid in the healthcare system there. That there is a lot to be done. There's plenty of work for everyone to do, and it would be an asset to your system.
Thank you.